This is Michael Smith of MedPage Today. I'm in Chicago at the Interscience Conference on Antimicrobial Agents and Chemotherapy, and I spoke with Dr. David Witt of Kaiser Permanente Medical Center in San Rafael, California. Dr. Witt is reporting on a surprising finding that comes out of last year's outbreak of pertussis.
Yeah, our county has a very high rate of personal belief exemptions. Parents can just waive the requirements for vaccines. Most states actually prohibit that. It's actually legally required unless there's a religious objection. So when we looked at our outbreak, we expected that this would be among our unvaccinated children. What we found, surprisingly, was that the vaccinated children were the bulk of our cases. The cases being unvaccinated remained an increased risk, but what we found is children more than 3 years from their last booster dose comprised the bulk of the outbreak.
And that would be the ages, I think, from 8 through 12, roughly.
Exactly.
What did you find, what's your interpretation of that finding?
Well, I think what we've concluded from this, and I think it needs to be studied in larger numbers and confirmed, but it appears that the protection from this vaccine wanes at about 3 years after your booster dose. And therefore, there's a 5-year preschool required vaccination. So children at age 8 are 3 years past that, and the rate of pertussis really peaked between age 10 and 12. At 12, children get another booster.
And presumably among the 13 through 18-year-olds, you would have seen then a corresponding drop.
And that's exactly what we saw.
Fascinating finding. Is there anything we can do at the moment, given the vaccine schedules are fairly are fixed and kind of a national design? What can be done to improve this issue?
Well, I think these results need to be confirmed. The vaccine schedules are such a massive undertaking and massive database behind them. But during an outbreak situation, I think it does bring up several potential options to have an impact. And we certainly did this in California last year. We started giving booster vaccinations as early as age 8, rather than waiting until they were 10 or 12 years old. We know that we should probably vaccinate those around the children at greatest risk. So the infants will never be protected by vaccine because they don't have an opportunity to. So we can vaccinate their parents, their grandparents, their caretakers, and their older siblings if there's an infant in the house. And during outbreaks, this would certainly be a strategy to blunt the severity of an outbreak.
In Chicago, I'm Michael Smith, MedPage Today.